Hey y'all, my name is Morgan Massa, and today I'm going to be performing range of motion on my patient, Miss Smith. First, I'm going to check the doctor's orders to see what needs to be done and make sure which way they want it done. I'm going to knock on my door, introduce myself. Hey, Miss Smith, my name is Morgan. I'm going to be your student nurse today. I'm going to perform hand hygiene, come in and check my patient. Miss Smith, can you state your name and date of birth, making sure it matches her wristband, make sure I have the right patient. And then I'm going to perform hygiene. I'll put gloves on. So I put gloves on, and then I'm going to raise the head of the bed. And so I'm going to explain to my patient what we're doing. Miss Smith, we're going to be performing range of motion today to get your muscles and joints moving just a little bit. That way they're not as so stiff sitting in the bed so long. Is that okay? Is this a good time? She states yes. So I'm going to raise the bed to a good working height. If the patient is able to tolerate it, you would sit her up just a little bit to do her head. So, first I'm going to lower the bed rails. So, first we're going to start with your neck. Is that okay? She states yes. So, at this point, I'm going to remove her pillow for a few minutes. We're going to move your neck side to side, okay? So, to the left, to the right. Can you bring your chin towards your chest? She brings her chin up. Can you lift your head back? She brings her head back. Can you move your head in a circular motion? So she moves her head in a circular motion. And then I'm going to place the pillow back under her. I'm going to lower the head of the bed back. At this point, I am going to move to her shoulder. So, Miss Smith, we're going to be doing your shoulder. You're going to make sure to support, or you want to hold the joints to make sure they are stable. So, you want to move up, down, and then to the side and back. And if your patient is able to stand up, then you would have them move their arm backwards. So, at that point, you would then move to the elbow, flexing it upwards and down. When you do these, you want to make sure to perform them in 2 to 5 sets, making sure that they're able to move and getting their muscles work. So make sure again to do it in 2 to 5 sets. So that will in or up, down, side, side, and then you want to move down to the wrist. Flex up, flex down, move side, side, and then you're going to move to your fingers. You're going to make a 4 with your thumb. You're going to flex your thumb out. Then you're going to touch each finger. And then you want to bring your fingers in and then flex them out. Again, doing this 2 to 5 times. Once you're done with your hands, you will then move to the patient's hip. And you would do this on both sides, but for educational purposes or for video purposes, we're just going to do one. So when you move your hip, you want to move up, down. I'm going to lower my side rails. I'm going to lift this one back up. I'm going to move my patient's legs side to side and then lay it back down. After that, I then want to bend the knee, rotate the hip out, rotate the hip in. Again, doing this 2 to 5 times. At this point, we're then going to move to the knee. You want to bring the knee up, back, straight, and then side, side. Then you're going to move to the foot. You want to do plantar flexion, which is moving their foot down, and then dorsal. Bring the foot up. So, foot down. And you want to move the ankle side to side. This is working the ankle. And then you're going to move to your foot. You want to bend your toes down and then stretch your toes up. Again, doing that 2 to 5 times. After that, you're going to cover your patient back up. Miss Smith, are you doing okay? How's your pain? Her pain, she said that it was fine. I'm going to lower the bed, ask her if there's anything she may need. Miss Smith, do you need anything to drink or anything? She states that she is fine, so I'm going to lower the bed to the lowest working height. I'm then going to lower the bed. I then want to document what I did. I'm going to perform hand hygiene before I leave the room. I'm going to go document. I'm going to make sure the call light is in reach before I leave my patient. All bed rails are up, so bed rail up. Bed rails up, call light's in reach, patient is the lowest level, and the patient is good and set. Mrs. Smith, you're doing good? She said she's doing good. So now I'm going to perform hand hygiene and then go document what I just did and if anything was abnormal when I did it.